Heart disease is the leading cause of death in the United States. The month of February is dedicated to raising awareness about heart disease and increasing knowledge about prevention. Tomah Health Cardiac Rehabilitation Coordinator Shana Steele explains how to keep your heart healthy and prevent heart disease during this edition of HealthCheck 360. Welcome. It's great to have you with us. So let's talk a little bit first about your role and how you are at the Tomah Health and how you help patients with heart disease or their prevention.
Yeah, so
services.
I'm the Cardiac and Pulmonary Rehab Coordinator at Tomah Health and have been for over 15 years. And we assist heart and lung patients into achieving a better quality of life and build their cardiovascular strength and endurance. And I have a team of clinical exercise physiologists that help to take care of all the patients that we see.
And so what might you be rehabilitating? Like, so someone had a heart, would that be like a heart attack? And then you're helping them rehabilitate after that? Is that what?
Some kind of post-trauma?
Correct. So heart attack, bypass surgery, heart valve disease, angioplasty or stenting, heart failure, heart-lung transplant, stable angina, just having chest pain that there's needs to be rehabilitated.
Well, that kind of goes into my next question. So heart disease is like this over-encompassing term, I guess.
Right.
So what are a few things people can do to prevent heart disease as in general terms, I guess?
Yeah, so heart disease refers to several conditions such as coronary artery disease, heart failure, heart valve disease, arrhythmias, so all-encompassing definition. But we do risk factor management, so to help prevent further heart disease.
So your patients are really already experiencing heart disease
Correct.
in some form or fashion, and you're trying to get them back onto a healthy path
Exactly.
and managing it.
Yeah. So through an initial assessment, we go through all the risk factors, being lack of physical activity or exercise, high blood pressure, high cholesterol, diabetes, being overweight, tobacco use, and stress. So we formulate an individual treatment plan to assist those patients in preventing any further heart disease.
It seems to be a common, all those contributing factors. They seem to
you know, it sounds even like when we're talking about even the COVID, the pandemic, you hear the comorbidity. And when you're going through those, Shana, it's sounding to me like obesity, heart, like those are all
Yeah. We all need to be aware of that and make healthy choices.
Now, we have some data that women are on the rise of heart. Can you talk a little bit about that with women with heart disease?
So women tend to have an onset of heart disease later on, more towards age 65 until they reach the same odds as men. Experts feel that the estrogen has more of a preventative effect on heart disease, but usually, like I said, by age 65, we're all at the same risk of developing heart disease. And it does run in the family, so you may be genetically predisposed to heart disease, so you're really important to make those healthy choices at a young age to prevent the onset of heart disease.
If you were going to pick like your top 2 or 3, like if people were going to make in February as we're making an awareness, what would you maybe recommend to our viewers? Like some of the easiest things you can start doing tomorrow or today?
Great question. Number 1, quit smoking, abstain from using tobacco.
Okay.
Number 2, exercise. Of course, I'm a clinical exercise physiologist, so find something you enjoy, find a friend or, anything to just exercise. At least 30 minutes, at least 5 days a week is what the American Heart Association and the American College of Sports Medicine recommend. And then eat healthy. So eat more fruits and vegetables. Half of your plate should be fruits and vegetables. No added salt, low sodium, low cholesterol, low saturated fat, less processed foods, more fresh.
Sure.
Yeah.
So is there any good news on the horizon in regards to your services?
Yeah, we do cardiac and pulmonary rehab, and actually also have a program for supervised exercise therapy for patients with peripheral artery disease.
Okay.
So we're continuing to expand and help our entire community with their health and well-being.
Awesome.
Great. Thank you for joining us on HealthCheck 360.